Hello everybody, welcome back to episode 234 of Random Musings from the Clinical Trials Guru. I'm Dan Sfera. I got the co-host Chris Sauber on.
Yeah, not host. That will never be.
Yeah, it will be at some point. That's the plan. So I've got an RFP, right? That's request for proposal. And I obviously can't say who, but the idea is, and if you are a university out there listening, there's a way for you to compete in the research space without having a med school and all that stuff that the traditional universities have. You know how like every state, California is a bad example because it's so big, but like Oklahoma, let's say, they have University of Oklahoma with a medical school,
Right.
nursing school, and then they have Oklahoma State, which is like non-medical.
A notch down, usually.
Right? So those schools assume that they can't compete in research, both in the private and public sectors. By public, I mean get NIH grants, apply for those, and you actually can. And this is something that came to me from two separate, completely separate entities. One who's has it thought out, much more advanced. The other one is thinking this but can't articulate it, right? One is a city, they're trying to do it. The other one is a large university that's a state school as well, they're pretty much a pioneer in research as far as like educating their students. So this got me thinking, both of those meetings, like either one of them on its own, I wouldn't have been that interested, but because they happened the same week, I was like, you know what, Chris? I called you up right after. I said, we've got a whole new business line right now if we can pull this off. Whether we win this RFP or not, I do think we're the best ones for it. But like, we now have a template for everybody.
And I'm curious, I'm sure you know the answer to this. That school there, do they have a degree program for research?
Yes, a master's.
Master's? So it only makes sense for them to get into the research field.
Yep.
So for any university...
And they're one of the few that do, but they're more starting to add.
Yeah, I know that. And I was going to say, any university that has a degree program certainly should have research on site as well, I would think.
Yes.
Right?
And there's two types of research. So there's the traditional one with hospitals, which is what most universities that don't have a med school think that they're not competing or not able to even compete in the space. That's called tertiary research centers, right? Like hospitals like Johns Hopkins, right? You don't just go to Johns Hopkins if you have cancer. You have to be referred by your doctor. And chances are you have to be referred to that doctor by someone else. So it's called tertiary research, and they apply for funding. You can actually be a community-based model, which is where we're sitting right now, an outpatient clinic or inpatient. There's plenty of private inpatient clinics, private hospitals not affiliated with any colleges or universities that can do community-based research. And they can compete for the public and private money.
Very nice.
Right?
Yeah.
So, and then there's also like cities that are trying to do this as well, because a lot of the universities and the cities work hand in hand, obviously to increase employment, things cities are interested in, which...
Yeah, we're kind of working on that too.
Yeah, that's what I'm saying. We had that talk that week with
Well, I thought you...
I can say who, it's LA.
Yeah, I thought you were referring to San Francisco, actually.
No. San Francisco is just where I monitor.
No.
It's like separate.
They... never mind. Go on.
Okay, yeah, the city of LA, right? So they want to do this without even realizing that other people are a little further ahead.
Right.
And then like literally a few days later I got this. I didn't solicit this, I got it. And by the way, this is public. I mean, anyone could go online and look at this, but I'm not going to say who it is.
Right.
But it's pretty much the roadmap. And they're asking you to respond to certain things. So let's go through it. Like if you're a university, if you're a college, if you're a city, anywhere in the United States listening, like, and you need someone to help you set up a research program, like our organization is the ones for you.
Oh, absolutely.
And here's why. So let's go through this a little bit. Let me see where. Okay, the intent. It's going to be hard for me to read this without spelling out who it is. But As part of an agenda to benefit society, we are exploring engaging in clinical trials and clinical research. We propose to develop a model for community-based research rather than a typical program based in tertiary care facilities. Such programs match our mission for the College of Nursing or the health program at XYZ University. Scientists, so they have like this private public sponsored type of company as well that's tied into this. So, and we'll get into it. We want to contribute to community health, provide learning and research opportunities, and compete for various grants and contracts that it cannot compete for now. We're seeking a consultant to evaluate this potential of community-based model, assess the cost, risks, and benefits of pursuing this strategy. Right? So now, they basically, here's the questions, okay, for this university, but it could be for a city as well. What is the size of the market for community-based research in our market, in our city, right? Or in this case, in our state? Who are our potential customers, competitors, and partners? What are our current strengths that could be applied to clinical research, right? Like, their university, they have this infrastructure, but they don't know, like, the value of what they have as in the context of clinical research.
Sure.
That's where they need people like us and our organization to help them out.
Yep.
Right? What financial investment would they require? What new resources and expertise will they need? Bless you. What new resources and expertise would they need to be required to be successful in this endeavor? What are the key and significant opportunities and threats? Can they negatively impact the reputation of the university? Define legal risks, if any. Possible negative impacts on existing relationships and programs that we have. These are the things they're concerned about. Could such a program be financially self-sufficient?
I'm just curious, have you answered all this stuff already?
Like half of it. I have all the answers. I just didn't put it on paper in the proposal.
All right.
But yeah, and then how and when could we expect to recover the investments, right? And then they want value-added services. So this is the roadmap. If you're listening, if you're watching, and you're one of these institutions, or if you're a city trying to work with a university in your area, and here's the thing, in my opinion, it doesn't even have to be a university, like we told the guy from LA, right, from the mayor's office. It could be a community college, because study coordinators, right, and this is where you got into it, so just break it down for anyone watching and listening in this role.
Well, first off, I think this could be easily summarized what we have to offer, right?
Right.
I mean, we do this all the time with our clients.
This is we're the perfect...
We do this all the time with our clients. We take research-naive physicians who contact us, ask, I've seen some of your videos, Dan.
Yeah.
I'm intrigued. I'd like to learn more, and could you guide me, walk me through how to conduct trials?
Right.
And they have no clue how to do it, right? And we do this all the time.
We do this every day.
Yeah.
And we take these calls every day.
Yeah, and we take on these clients.
This is no different.
And we guide them through research.
Now here's the beautiful thing for a university. And we'll get back to the community colleges too, because it can work for them also. But for the university, they have nursing program. This one actually has a master's in clinical research.
Right, they have all the key components for the most part, right? They even have, this university, they have a master's program in research, so you would assume there has to be individuals there that already know how to conduct trials. They could be a good coordinator per se, right?
Yep, and they also have like an incubator, just like the incubator we were dealing with, where they're developing molecules. Like, so they're the sponsor, they're the CRO, they're the site. They can be the CRAs, they can be the vendors.
Yep.
Because now you can integrate all their other programs like technology, right? They have computer science majors there. Why can't they build an EDC and a CTMS and an eSource?
Yeah.
Why should they buy it from someone else?
They no need to.
They can build it in-house.
Surely could.
Right.
They could offer that as credit to, or extra credit to whatever, right? They're building an EDC, the computer system software engineer, and
right. And they can employ their graduates. Yeah. Or they can make it mandatory for the grad students to work on these projects.
Yeah. Yeah.
Just like they do in medical school. They make it mandatory for them to intern.
Right.
In residency. Right. So have something similar. And to be financially self-sustaining, this is not difficult. We have this conversation with clients all the time. This is no different than a mom and pop in Idaho that wants to open up a research clinic. Like you get a study, you can be profitable within 3 months of screening, right?
That's a little rough, but 6 months surely.
Sure, but a university like this, they can sustain for like 2 years.
Well, they really have no expenses. What would be their expense?
I mean, partnering with clinics outside, like they would have to find a doctor in the community.
That's true.
But they have the leverage of having a brand name.
Yeah, they're universities, so...
And we could bring you studies, and not only can we bring you industry studies, but we're going to apply for NIH grants, because we're a university, and our scientists are working on all these things. We're going to apply for grants for all these things.
Right.
So even if we can't get you industry studies, which we can, because we do that all the time, we're going to bring you our own studies, and you get paid for that.
Sure.
You see how this works?
Oh, absolutely.
And this could work for any university. Now, how does it work for, and if you don't have a clinical research program in your university, you can create one.
Well,
You can create a major for that.
You can, sure, but there's still aspects of this that would be ideal, well not ideal, but would be helpful to your other educational programs, like you had mentioned, building the EDC software,
Right.
things like that.
That's all going in my report, too.
Right. So there's a number of different career paths, or not career paths, but degree paths that this would be beneficial towards.
Right, right. And now let's break it down for the community colleges, too.
Mm-hmm.
I know they have smaller budgets, but we work with sites, we work with entrepreneurs that don't have any budget.
Well, you do need a little bit of startup money.
Well, you need to cover your living expenses, but if you talk about someone like at East LA Community College,
Mm-hmm.
I mean, they have enough of a budget to start a small site,
Sure.
and they have the people in there that they can train to be the coordinators, right?
You would
And then
think,
it's just
yes.
a matter of finding a doctor who wants to be affiliated with that college.
And there doesn't necessarily need to be any cost associated with that either. Immediate expense, right?
Right,
Because you can pay them percentage of the budget,
right.
thus no cost.
And you're starting, if you pay attention for anyone watching or listening, you're starting to see a lot more of these programs popping up at these universities, clinical research.
Mm-hmm.
Tons.
Yeah.
And it ties in nicely to any other medical degrees you offer, or it doesn't even have to. It could be like in your entrepreneurship
Yeah,
program.
community college, a great program would be a 2-year coordinator.
Like an associate's degree in clinical research.
AAS and CRC.
And you can do it. I mean, you can have a bachelor's in clinical research or a master's, right?
Honestly, it's just my opinion, but true of most degrees. I don't think there's enough material to have a bachelor's as a CRC, but
I think for an associate's it's good.
yeah, I do too.
Or maybe it could be like a minor, not a major.
Yeah.
Or like a specialty. But I understand why it's a master's program, but it doesn't really matter what it is.
Right.
They can start doing this so it create an ecosystem that feeds itself.
Yeah,
right?
absolutely.
They get the studies, they get the funding, private, public. Now they have the students, now they can get jobs for their students, they can get training for their students.
Yep.
They can build technologies for their own business from their other programs.
Sure.
What else am I missing? Impact the community, like increase minority participation. That's something that's very important for these guys. I forgot to mention.
And they could offer internship, as we do with our students. They could offer internship at their school, right? I mean,
Yes.
each graduate gets to work in the clinic for 6 months,
Yep.
right? And then you're much more viable in the industry to get a job once you actually have that hands-on experience.
Right.
So yeah, it'd be a benefit.
Yeah, these they're very interested in increasing minority health outcomes, and they don't know that they're interested. What they're really interested in is increasing minority participation in clinical research, because that's how you get there.
Yeah, well, they could mean outcomes, right? In terms of
No, they do. They're talking big picture,
they want the drugs designed specifically towards
Yes.
those patient populations.
and they have the institute where they're doing.
But you're
it.
right. You need more participation in research by those populations to design drugs for them.
Yeah, there's no way you would know if it works on this particular minority group unless you have them participating
Testing
in
the
studies.
drug. Yeah.
And this is what we help our clients with also,
Right.
right?
Yeah. Absolutely.
And the best way to get minorities involved in clinical research as patients is to get more minority physicians and nurses
It's certainly
involved
helpful.
in clinical research.
Certainly
I mean, look
helpful.
at Monica here.
Yeah. Certainly helpful.
Minority coordinators that go on and open their own site. This could tie into the university's business programs too.
Mm.
There's just a lot here. I think we're going to be busy for the next decade with this.
Maybe longer.
It could be. It's just, let's see where which one will be more lucrative for us. This, we're gonna do both, but this or like actually being a sponsor, I don't know, but we're gonna test.
Yeah, hopefully we find out.
Yep. Anything else you want to add that we missed?
No, I think that was good.
All right. Thank you, Chris. Thank you, everybody, for watching and listening, and we'll catch y'all later. Bye bye.